Hi, this is Dr. Tieche from Recharge Clinic, and I'm with Brittany, and Brittany is getting an iron infusion. So iron infusions are used to treat symptomatic low iron. We also include anemia in there many times, but not everyone that has a low iron level or a symptomatic low iron level and slash ferritin level have low blood count. They can, but they don't always. So there are some symptoms that are very common to people who have iron deficiency. Extreme fatigue, sometimes leg cramps, shortness of breath, things like that. And so, one of the main treatments is to try and give people oral iron supplements. And, just by taking it by mouth and having that iron get absorbed through your intestinal tract. The main problem with that is two. One, it takes a long time to correct someone's iron when it's very low. Secondly, most of the iron supplements really bother your stomach a lot. They cause a lot of nausea, and then they can cause constipation and or cramping. So it's a big problem. So Brittany, do you experience this? Brittany had low iron for years and years and years, and was given iron supplements multiple times, and really her iron levels got so low that she was having shortness of breath, anxiety, basically extreme fatigue, dizziness, all of these kinds of stuff, and really was just told, well, it's just all in your head, hon, it'll all go away. And yeah, and which is a frustrating thing, and just take your iron tablets. Well, the iron tablets, it's an okay trial. I think it works very well as a trial, but after that you have to kind of jump in and fix it. And so that's what we're doing. We're giving her iron infusions. It's very safe. This is her third one, and she feels dramatically better. Not 100% yet, but we're getting there. It doesn't bring it all back up to normal. As a matter of fact, I've had several iron infusions myself. My iron level was low, and I did that same thing. I tried taking oral iron for more than 6 months. I kept doubling my dose, and after that, I thought, okay, this is going to be great. I checked my level, and it had barely moved. It was so frustrating. I was having leg cramps, was tired all the time, and really all of my other labs were really normal and optimized. So after I did some iron infusions, it was pretty amazing how much better I felt, and it was was really no problem at all to do it. So I'm really glad I do it, and I really just want people to know that this is another form of therapy that we offer here. But also, there's a lot of people that have iron deficiency. It's becoming a very common problem, U.S. and worldwide, and really it's become from dietary stuff, and even people who are meat eaters and say, why would I get that? I eat a lot of meat. Well, really the amount of iron that's in some meat is not as much as you would think, and not everyone is eating red meat. People have gone more towards eating fish and chicken, so those are very low. Depending on the vegetables you get, certain vegetables have very high iron content, but a lot of them do not. And even with kind of really the way plants are grown nowadays, all of that trying mass production, really the nutrient value in plants is much lower. So the iron levels are lower. So it's becoming quite an issue worldwide. Doctors are noticing much more lower levels of iron. So, yes, it's nice to try and change your diet. That may work at mild levels. Taking iron supplements, yes, that may work as well. But when it doesn't, after a while, you just have to fix the problem. There's no more talking about it. It was really impairing her quality of life, as it did mine. And really, it changes it very, very dramatically. So if you have any more questions or you'd like to talk to someone about it, please contact us.